website. So, Rupi, can you remind us how this all started 4 years ago?
Yeah. I remember it vividly. So culinary medicine isn't a concept that we've created amongst ourselves. It's actually something that's existed for many years in the United States, where they've been educating a number of different professionals, largely medical school students, the foundations of cooking and nutrition. So really, I remember going over there and speaking to a number of different innovative universities who were doing something in their local areas, and I decided, we really need something like this in the United Kingdom, something that's reflective of us, something that we can own ourselves, because it's very different to how they do things over there. And I just put a call out on social media. I remember it was late at a weekend. I knew I wouldn't have been able to do something like this myself, so I put a call out on social media, just saying what my idea was, and everyone around here sort of really rallied around it. And I remember Elaine was one of the first people to reach out. Yourself, Abby, was one of the first people to attend one of the professional courses. And Vinny was the first person that was roped into teaching the course when he had no idea what culinary medicine was. So that's really how it started.
I got an email, actually. I didn't see the call.
Oh, really? There you go.
Actually, I emailed you as well.
I saw the call out. I came to the kitchen launch. I saw that. I was like, I need to be part of this.
I just got told to attend work on a Saturday, and very rare.
So, someone who actually saw the call out.
I was there.
Why didn't you tell us about it?
Well, do you know, I remember reading it, and I remember I'd been following Rupi on when he had his platform, Doctor's Kitchen, and he was talking about this course, and I thought, wow, I would have loved to have done that as a medical student, and I would probably represent a lot of doctors who thought I would love to feel more confident to talk about nutrition. I had a background in health coaching, and it felt like a very, very important gap in our training, and I was really interested to find out more. So I came along as a curious healthcare professional. I thought, I'd quite like to help with this mission. The more I heard about it, and it kind of went from there, and then and here we all are 4 years later, sitting in the same kitchen, which is
a perfect fit for somebody like yourself in that position. Big
absolutely.
Time. And I remember at the time as well, I was doing a lot, because culinary professionals don't learn about nutrition either, and I was trying to get a bit of a movement on that too. So when I did discover what was going on, I think I kind of had a little chat with you one day in the kitchen and just asked to get a bit more involved with it, which is it's been great. We haven't looked back since, have we? It's been really good. We've had some really interesting live sessions as well.
Absolutely. So I was teaching nutrition. I'd only just started teaching nutrition in medical school, and what struck me is that there's very little opportunity to talk about the nuance of nutrition. So it's not so straightforward as this is a pill and you must take this as this is your prescription. It's much more complex, because you have to think about where that person's at, and there's so many different medical conditions that we need to think about. So I had an email to say, did I want to be involved? Because I was already teaching nutrition in medical school, and being a dietitian, teaching nutrition in medical school, I pretty much was a unicorn. So, and it was great because I think that when I was giving lectures in nutrition, I just felt like it wasn't the whole story. So it's really important, I think, when we're thinking about food, one, that we can think about actual food and not nutrients. It's not the same as opening up a textbook and just reading out a lecture of what you need to do. It's about how you apply that to people. So I really like the idea of teaching in a kitchen, and I still do.
I think what you say over there, it doesn't feel like the full story. I think that's what really resonated with me. So I remember at the time when I'd reached out, I felt quite stuck professionally. A lot of traditional medicine didn't quite make sense to me. And I was looking for opportunities to sort of, I guess, broaden my repertoire of what I could offer to my patients. And as one of the first students, I remember sort of, cooking one of our first meals. I think it was pancakes. We were making blueberry pancakes. Or even a better example, the vegetarian bolognese. And I was like, this just makes sense. Okay, I'm not here to train as a chef, but through this process, I kind of understand what my patient is going to go through, and I can talk about it in a slightly richer way.
absolutely. And I just love that we all come from different backgrounds, different professions. And so,
disciplinary.
Yeah, it's so nice to work with the chef and work with the doctor. And so it's really nice to be working in such a multi-professional team. So I'm a dietitian, but nobody's a one-man band when it comes to nutrition for patients.
Yeah.
Like you might introduce a topic as a doctor, you may refer to a dietitian. I want to make sure that the information that I'm giving is tasty and creative, and it's really great to be working with Vinny and to think about ways that we can do that better. So I think this is what sets us apart as well, is this collaborative approach.
Definitely. I think just being able to sort of see these different perspectives, it gives you just such a wider angle from a patient's point of view.
Yeah.
And I think a lot of our resources really appreciate this multi-professional attitude I guess we have.
Yeah.
And I think one of the best things about the culinary medicine team is that we lean on lots of our colleagues in different specialties, even within dietetics, within medicine, even amongst the culinary professionals as well, to really lean into how we can design meals and foods that are reflective of people's cultures and environments. And it might look like this has been plain sailing for the last 4 years, but actually we've had a whole bunch of high and low points. I mean, one of the best points for me was opening this kitchen with the help of Westminster Kingsway. I mean, was that something that...
Yeah, they've been great supporters, I think we have to say as well, don't we? I mean, Westminster Kingsway have helped us really shape how we can make the practical work and keeping it a bit more... at first, we were doing it in our professional kitchens, which was great, but not many patients are going to be in professional kitchens, if you like, so we moved it down to more of a home style kitchen like we have here today.
It's a great example, as in it shows there's actually a willingness within the landscape to think a bit differently, and we need to find champions like Westminster Kingsway and sort of just connect the dots, because I think the solutions that come out of these kind of connections are really game changing.
And the other thing, we've had so much positive feedback about being in the kitchen, also having culinary arts students helping. There's been real kind of cross-sector working and collaboration. I think that's very unique about our organisation. And they've also said they've benefited from being around the healthcare professionals.
So some of our 16 to 19-year-old cohort, for example, really enjoyed working with the medical students. They kind of, because they're quite academic and everything else, they were very much a bit intimidated at first, actually, the chefs, the young chefs. But then they came out of there all suave and saying, they can't do anything, chef. They can't do anything. I have no clue what they're doing. They burn water. And now, actually, we've started now to introduce our higher educational students, which has actually been very beneficial. And we've started to see a way perhaps of building them champions as well for them to take that forward. And some of my HE higher education students are involved in local community projects as well around London, so that's been great as well. So.
And you mentioned sort of, we've mentioned the kitchen and how sort of pivotal that's been to our journey, but really if we sort of think about it, something that we never talk about is actually the table where we have the conversations. I know this is on a very small scale, but the conversations that we're having, we're nurturing. If we were to have them at scale, I think it would completely change the landscape.
Absolutely. And I think it's not so much about what we need to know, it's about how to put it into practice. So it's so similar to our patients, I guess, in a way that, it's the how that's important. It's how do we have these discussions and how do we address this in healthcare? But there are some challenges.
Yeah, we've definitely faced some challenges.
We've come across a few.
Talking of challenges, so one of the main reasons why we are doing an online course is because the pandemic kind of forced us online when we were doing the content and delivering the courses for medical schools. But also we were asked by so many people as well to create an online course so you can join wherever you are in the country or even in the world as well. And this is really what we've created for you here. So we're super excited for you to jump in, look at all the modules and learn culinary medicine.
Yeah, absolutely. And if you like it, also come see us in the kitchen.
Well, in terms of future plans, we hope that actually to accompany the online course, there will be culinary medicine experience days to really cement what you've learnt on the online course. So you'll be cooking at home, and then there'll be future days we can come and cook with some of our chefs and have those table discussions, talk about clinical cases. And yeah, it's going to be a fantastic resource.
Yeah, and actually we should probably stress that there's nothing to be, maybe scared is the wrong word, but don't be scared. It's part of the process. Come in, come in for one of our taster sessions, try the online course, and as time goes, you grow and you learn more and more.
Yeah, I think it's a very relaxed and inclusive environment here, especially in the kitchen, and when people are cooking, it can be very therapeutic for some people, and they really relax, and the conversations that we have with them in them days are it's brilliant. They just open up and talk about everything. So do my students actually. So yeah, this will be really great. So looking forward to welcome you to Westminster Kingsway at some stage.
Yeah, absolutely. And I think one of the barriers for health professionals in talking about nutrition is confidence. So that's something we really work on is practicing how to have conversations with patients.
And confidence in cooking.
Confidence,
Yeah.
confidence in cutting an onion.
Yeah.
Practice what you preach.